V10 is ICD-10 compatible, so we're going to show that to you. V10 is Meaningful Use 2 certified. You're going to see that. And then you're going to see all the fit and finish and usability ideas. We did 134 of them from ECW users alone. ECW ideas. If you voted high on that list, we took it, we put it in. With that, Sam, could you kick us off and show us some of the, if they don't applaud, don't go to the next feature. He's going to show you some of the cool features of V10, and then we're going to turn it over to Dr. Raj.
We have included ICD-10 as part of our V10 platform, and let me show you how it works when you're trying to search for a diagnosis. And if you have enabled ICD-10 in your practice, and you can enable ICD-10 based on your preference, you can enable for all the payers or only some payers. You'll end up seeing ICD-9 and ICD-10 side by side. You'll also see some ICD-10s lighting blue. That means there are multiple ICD-10s associated to that specific ICD-9. The system allows you to specifically identify more details about that diagnosis. If it is conjunctivitis, is it on the left eye or on the right eye? And the system automatically selects ICD-10 for you. In some cases, for one ICD-9 code, you may now have to select two ICD-10 codes. In this case, it is a cervical spine fracture, and I may have to now specify, in addition to selecting a baseline ICD-10, is it displaced or non-displaced fracture? And it automatically selects those two different ICD-10 codes within the node. As you heard, version 10 is Meaningful Use Stage 2 compliant, and there are many small variations that you may have to do within your documentation. One of them is family history. With family history, you now have to capture information in structured format. So we have made that very easy for you. If you want to document your spouse got diagnosed with diabetes, or the patient's spouse got diagnosed with diabetes, I can easily check the box and indicate when the family relative got diagnosed with that condition. And it documents that information in a structured form. Flow sheets. Many enhancements on the flow sheets. First of all, it looks clean. And if you order certain tests from multiple different labs, sometimes you order hemoglobin A1C tests or lipid tests from LabCorp or Quest or different hospital systems. You wanted them to appear on one single row instead of multiple rows. We have made that easier for you to see all those results appearing in one single row. You can now export flow sheets into Excel. You can also lock flow sheet entries if you prefer to enter information directly into flow sheet. We have added a graphical timeline view to the flow sheet. You can now correlate the effect of medication on the lab result. As you can see, Lipitor has a positive effect on the patient's cholesterol, as well as metformin has a positive effect on the hemoglobin A1C values. You can also see the structured data and immunization information. Whatever you have in the flow sheet is visually available on that graphical view. We have streamlined your front office check-in process. Did you notice something new on the right panel here? You can now see the copay. You can now see the copay information, account balances, but also the eligibility status on the same screen. And better yet, If there is any discrepancy on that information that you have about that patient in your EMR and what insurance is saying that they have, you will be able to bring that information. If the copay has gone up, bring that information into your note with one single click on these arrows. If it is a brand new patient, you'll be able to check eligibility on the same screen as well. And we have made your life easier to read the information that comes in. Let's look at some enhancements on the immunization side. First of all, immunization and injections are separated out nicely. And when you look at the immunization schedule, first of all, we show you the patient's immunization history, whatever has been administered, along with whether the patient is compliant or non-compliant based on the CDC guidelines on the right-hand side. And you'll also notice this patient is due for certain immunization right now. I can just click on that ad and administer that immunization. And if patient decided to refuse that immunization, you can indicate that patient doesn't want to take that immunization because of a parental reason or religious reason. This is one of the meaningful use requirements as well. The one I like the most is the right-hand panel on the immunization. This information is coming from the state immunization registries that you may have within your states. Any immunizations that are administered in other locations available on the registries, visible on the right. And with one click on these arrows, I can bring that information into my note as well. Many of you have asked us to enhance the med reconciliation process in eClinicalWorks. First of all, it looks great. To review the medications with the patient, it is a lot easier now. I can say a patient is taking these medications by clicking on T, T for taking, and N for not taking. Patient stopped taking amoxicillin, and patient has discontinued cardizine because cardiologist asked patient to stop that medication and decided to prescribe a new medication there. That's a lot easier now. And if the patient has discontinued something, visually it identifies that information with a strikeout. Past medication histories. You can group them by date, by medications, or by providers. As you are reviewing the past medication histories, the little H allows you to see the history of that specific medication over a period of time. Well, on the progress note, earlier till version 9, you were able to click on all these blue hyperlinks. Now we have made the blue, the purple, the green, and the black, everything clickable. I click on symptoms, it takes me to the right place. Click on diabetes, takes me to the right place. I can go next or previous to enter additional structured data elements. And when I click on any type of attributes, in-place data entry right there, as well as ability for you to jump to different section as you're capturing the data. Well, we have not forgotten practice management. When you send out patient statements and patients start calling you about making the payment for the outstanding balances, let's see how easy it is to post the payments. There's a $40 balance on this patient's account. And right from the patient hub, I'll be able to post the payments directly and better yet, you'll be able to process that payment using our credit card system as well. Denial management. In version 9, you are generating EBO reports to follow up on your denial management. We have made it interactive and real-time in version 10. When you're looking at the denials that you have received from your insurance carriers over a period of time, you can first of all group them by facilities and insurance groups. But if you're interested in looking at certain types of denials that you have got from the payers, you can only select those categories, like non-covered services and coding issues. And when you look up, you'll be able to see all those denials that you may have received. And I can easily expand on those denial details and go all the way to the CPT level and look at the associated denial code at the same time. If you wanted to see the trend within your practice with respect to the denials that you're getting, we have introduced the analytics system that now allows you to graph all these denials that you're getting over time, such as denial 50 happened only 4 times, denial 16 happened 8 times in the last 12 months. Let's look at some enhancements on the right panel. Did you just notice there is a red alert on the right panel here on the problem list? It is red because I have not administered or reviewed that specific problem with the patient for the last 12 months. It is important in many of the initiatives that you're starting, PCMH, PQRS, managed care contracts, to start making sure that you are up to date with the problem lists and reviewing them on a regular basis. Based on your requests, we have added global alerts to the right panel. We have introduced the patient timeline in the timeline tab of the right panel. With the patient timeline option, you are now able to see all the lab results, phone calls, web requests, radiology results that you have received for that patient in a chronological order, all in one single place rather than going to different categories. You can also do show me only the results that have come in that were ordered by me. As you are reviewing these results, many of you are using this capability of bringing lab results into your note by using this left arrow, which was an existing feature of version 9. Right there, I just imported one. But with version 10, we are introducing another arrow key here to import cumulative lab results. If you wanted to import multiple hemoglobin A1Cs that you have done for this patient in the last 12 months, one click, I'll be able to import all the results. Well, many of you have been taking pictures as part of your examination. Now you can embed them as part of your note, right there. But better yet, if you have already taken some pictures in prior visits, when you click on this caret, you will be able to see a quick glimpse at that previous picture and import that picture into this visit so that you can do a side-by-side compare between those two pictures.
These are some. This is the tip of the iceberg. There's a lot more. You need to go explore them in sessions. But if you notice the progress note, it is not one tab anymore. You saw something next to it. Saw 3 more tabs. We call it the 3-tab progress note. I have Dr. Raj here. He's going to be your practicing clinician for the morning. He's going to show you a dramatically new way on how to use eClinicalWorks EHR for documenting a visit with version 10. You've seen Scribe before, but you haven't seen this before. You will see something that is quite unique. And suddenly, instead of talking about clicking everywhere, using order sets everywhere and templates, you might start saying, I just dictate my notes and enter my orders, and I send them, all with one click each. So with that, let me transition it over to Dr. Raj, who's going to walk us through and show us the integrated workflow of how a primary care doc and or how a specialty care doc both can use this nicely incorporated capability within the progress note, so you can do it based on a visit-by-visit basis, whatever fits your workflow. Dr. Raj, take it over.
Thank you, Girish. Thank you, Girish. As Girish mentioned, there are 3 tabs in the progress note that I feel will revolutionize how you document your progress note. And I'll walk you through some scenarios and see how that works. First of all, I'm going to go into the first tab on progress note, review what my medical assistant has entered, why the patient is here for. Next, I jump onto the window for Scribe. And today, I'm not going to use dictation, but show you how you can use several key commands and the capability to walk through a note. I'm going to use an EMR macro for knee injury and load that macro. I'm also using a different keyboard command to load that particular macro that I have created in Scribe. Next, I use a function key to go and document a progress note. So this patient is here with a complaint of right knee pain. I use a function key and jump in here and say pain started yesterday. The injury was due to fall, and I select that option and say patient is complaining of pain and redness and swelling, so I can choose multiple options from here. And I say this patient was also seen in the emergency room, and X-rays actually showed no abnormality. I can walk through, and for all of this, I have not touched my mouse, I have not used my dictation, and I'm simply navigating through the note. Next, I could continue to do the examination and say, okay, I am examining the right knee here, and inspection shows there is no ecchymosis and there is no erythema of the joint, and palpation shows there is some tenderness, so I'm going to undo this and go back and say, well, there's tenderness on the medial joint line, and I am done with my HPI and examination without really having to touch my mouse or even dictation. Next, I can take the command and put this in the progress note. So as you can see now, all of this data has entered my progress note in a structured fashion. But that is if you want to use the capability of Scribe even without voice dictation. You can certainly use something such as my office visit template, and again use the function keys to navigate through different sections, and you'll be able to dictate your findings if you prefer to do so. There are also several other functionalities such as order labs and order medications and so on, and it'll allow you to do that. If I had ordered a medication and I decide to send that prescription, it will open up a common send button, which I will talk about in a minute. But Scribe has the capability, and as you can see, I've typed it and clicked it, but I could also use my voice commands to navigate through the entire progress note. So that is the Scribe. We have also added a lot of new commands in Scribe to be able to do pretty much entire note without you really having to touch your keyboard or type a whole lot for that matter. Next, I'm going to move on to the order screen and walk you through what type of orders I can put in. So for this patient who came in for knee injury, I'm going to order ibuprofen. I have the diagnosis available here if I had entered this in the past. Once I chose the diagnosis, I can choose the medication that I want. I choose the strength of the medication, and that drops it into the diagnosis. I also want to order Percocet in case the patient has severe pain, because I figured patient has broken the meniscus. So here again, I'm doing the same thing, choosing the strength of the medication that I want to order. And I also am thinking I want to get an MRI. So now I order the meds. I'm going to get an MRI of his knee. And here is my right knee MRI that I want to order. Looks good? But this is the primary care visit, so we are not done yet. The patient says, I stopped taking my thyroid pill. Can you refill my medicines? And I said, fine, no problem. I can do that from the same screen. So here's my Synthroid, and here's a 25 microgram dose. But before I choose that, I'm going to select the diagnosis of hypothyroidism and then select the dose. So now it goes under that diagnosis. I believe I did not. Just do that again. So here's my diagnosis, here's my medication, it's already exists. Okay. Now, next I'm saying, well, you're taking your Synthroid, you're restarting it, let me get your thyroid function also at the same time. And again, the same idea, I'm going here and ordering my TSH for that patient. But patient says, doctor, by the way, it's flu season, can I get my flu shots too? And I said, as long as I'm on the order screen, no problem. Here you go. Here's your flu shot. You get the flu shot. It's also ordered. It puts in the pending state for me. As you can see, it allows me to do pretty much anything I want to do, order any kind of meds, any kind of labs, imaging studies, referrals, and injections. But that's not where I stop. This is my stage 2. My meds need to go to a different place, my labs need to go to a different place, and I need to send a visit summary to a different place. How do I do that? Well, there is a common send button. When I click this, I look at everything that I entered on today's visit. I have medications here, which since the patient does not go to a pharmacy that takes e-prescription, it has changed to print. If this was a pharmacy that was taking e-prescription, it will be e-prescribed. It tells me that if I want to have the patient take Synthroid and do not substitute that, I can uncheck that, and that'll send the prescription to the pharmacy as do not substitute or dispense as written. But I'm getting ready to send the prescription, and the system is telling me, hold on. You get these red little icons that's telling me that you have not entered the dispense duration refill information for the pharmacy to process that. So there's a lot of decision making that happens here that I'm able to do that before sending the prescription out. Similarly, I can send my labs here. I can send the MRI order to the imaging study, and since my lab takes the electronic order, it has the e-transmit button, but my imaging center does not. Do not interface with that, so I have a print option there. But I don't want to forget the doctor who's going to be seeing my patient for knee injury. I can go in here, and if you guessed it, yes, if the doctor is on the network, this will go to the doctor through the network. On the other hand, if the doctor is not on the network, I could fax the prescription, fax my consult note, or fax my office note to this doctor by choosing it from the list. So this screen allows you to take all the information and send it to as many sources as you want to. But wait a minute, we don't want to forget the patient, right? What about the patient? Here's the patient. If I'm web-enabled, the visit summary will be published on the portal. The same immunization, if I want to print out a state form, I can do that. And there's also an ability to print or publish the patient education, whether it's RX education or a disease education on the portal. You also have an option to preview your visit summaries by clicking here, and certainly the education you can preview. So the send button, the common send button, summarizes all the communication that you need to have with all the entities that provide care to the patient, and certainly has a direct communication built into the patient as well. So those are the 3 major functionalities of version 10. I'll turn it back to Girish.
Wow. You know what happened? I went to see a doc. I was in town, just went to talk to him, and he made this comment. He said, there are more clicks in your product after the done button. So we figured out just to have one send button after that, so we didn't have to worry about sending prescriptions separately, orders separately, visit summaries separately. It's all now one click to send everything out. It's big. The 3-tab progress note is going to be unbelievable. And he didn't show you the dragon capability. So go sit to a topic where Scribe is shown through dictation, or where you see the primary care overview or the specialty care overview topics, and they'll actually go even more in depth into terms of what you could do. But I did tell you that you can learn from fantasy football. Did I say that? Not all ideas come from ECW ideas. Some of them come when you're doing your draft. This is a real story. I'm not making it up. He's right here too. He can attest to it, Dr. Raj's son. He and I were sitting. He was my co-pilot that day. While I was busy drafting the ECW Legends League, as they call it. It's pretty intense. Reigning champion last year. So what happened is, we were in the 3rd or 5th round, I forget. And I asked, so who's the tight end for Detroit Lions? I asked that question, and then right away I go to ESPN.com. Then I click on NFL. Then I click on teams. Then I click on Detroit. And then I click on depth chart. Make sense? Just tells you how much I do fantasy. I know the whole league click process. And he looked at me and he said, it's not how you do it. I think he shut up, he didn't say much. 2 rounds later, I asked the question, so who is St. Louis playing in week 8? I want to know, because I want to know the matchups. I did the same exact thing. NFL, ESPN, NFL, team, schedule. I think he finally spoke up. Says, you don't do it that way. You see that search button on the top right? You just type in that search button, Detroit schedule week 9, and Google will find it for you. I'm not that old, but I grew up in the Windows 3 world, Windows 95 world, and you and I all learned the file menu. File, save, open, close, documents. So I'm clicking on websites to navigate links, and this guy grew up in the search world, so uses search as his navigation tool. Make sense? So what do we make you do when you're looking for a CBC for a patient? What do we make you do when you're clicking on flow sheets? So we decided to put a search button inside the progress note. I want to show it to you. Raj showed you the 3 tabs, the progress note, the scribe, and the orders. I'm going to show you search. You just go in and you say .o CBC. Shows you the CBC. You do it and see your results right in place. Why do I have to click? You go .f, diabetes. What do you think it does? Shows the diabetes flow sheet for you. You can even close the right panel away if you like. You can close the top panel away, get more real estate, and then you go into search and you can do this. It even gives you more space. Let's do this. Hold on, I did it. Oh, there's a space there. It's okay. Oh, my mistake. I get nervous too, guys. It's not just you guys. Come on. Clap for that, please. Please, please. Yeah, that's cool. That's good.